What up, people? One of the most common questions I get asked in the pharmacy, in the clinic, out in the community, or whatever the setting is that of fevers. Fever is the most common, or one of the most common reasons patients come to the pharmacy seeking relief. I was reading an article and it said that every year there are 12.5 million office visits from patients seeking relief from a fever, and most of those patients are men. So I just want to kind of set the record straight on some things when it comes to fevers. A fever occurs when your body temperature, your core body temperature rises above 100 degrees Fahrenheit. But a fever doesn't really cause any harmful effects or dangerous complications until your body temperature reaches 106 degrees Fahrenheit. And in fact, most fevers go away naturally. They go away on their own, and you don't even need medication in some instances. But the question I get asked is, what are the best treatments and techniques and strategies available to treat fevers? Well, there are many of them, and those techniques involve both pharmaceutical and non-pharmaceutical methods. But there are really only two major reasons why you would want to treat a fever. You would want to treat a fever, number one, to relieve any discomfort that a patient may be feeling from the fever. And number two, to treat the underlying cause that may result in a fever. But you really don't want to treat a fever to lower your body temperature. Why? Body temperature, a rise in body temperature can be a positive warning that there is something more serious going on within the body. But here's the most important thing you can do when you suspect that you may have a fever. It's to accurately measure the fever. A thermometer is the proper way to measure a rise in body temperature. There's a big difference between a rise in body temperature and core body temperature opposed to a rise in skin temperature. A lot of people feel around their skin, their body, on their head, neck area, under their arms, all over their body to try to determine if they have a fever, and they misdiagnose themselves and end up taking medications unnecessarily, going to the emergency room when they don't have to, making appointments to go see a physician when they don't have to, taking time off work when they don't have to, when you could use an FDA approved thermometer, get an accurate reading, and that way we could evaluate and assess if you are indeed in any potential danger from a fever, or if there's something going on that may be causing a fever. So what I've done on my blog is I've written a short piece that's very informative, that talks about different causes of fever, different treatment strategies, and I've given 11 recommendations to treat a fever when you suspect that you may have a fever. So go to the website, drcooperthepharmacist.com, review those, use those however you feel necessary. And if you have any questions about anything, any of the treatment strategies, different thermometers, the best way to get a reading, the best way to measure your core body temperature, ask me on the website at drcooperthepharmacist.com. Follow me on Twitter at Cooper Pharmacy, and like Dr. Cooper the Pharmacist on Facebook. I'm Dr. Cooper the Pharmacist. I'm the voice of medication. God bless you. God bless your health. and God bless the United States of America.